This lowers blood sugar faster than anything else. Do you have pre-diabetes or diabetes and want to lower your blood sugar quickly and effectively? In this video, I will show a simple tool to reduce your blood glucose faster than anything else, and note, consistently. If you are pre-diabetic or already diabetic, regardless of being type 1 or type 2 diabetic, you should use this tool every day. What is this tool that immediately lowers your blood sugar, as well as your average glucose, HbA1c, do you know? If you thought about improving your insulin sensitivity, you're right. By improving your insulin sensitivity, your blood glucose will be much more controlled. And who knows, if you are a type 2 diabetic, you might reverse this disease, get rid of it. And if you are pre-diabetic, you could escape diabetes. Let's go. What is insulin sensitivity? Insulin sensitivity is an indicator that shows how your body reacts to the insulin your pancreas produces. If your body reacts well, it is sensitive to insulin, which is a good thing. If your body reacts poorly, it is insulin resistant, meaning it becomes less sensitive to insulin, which is a bad thing. If you didn't know, insulin is a hormone secreted by the pancreas. What does insulin do? It is crucial for good control of your blood sugar. When you eat something, a roll, a banana, your rice and beans, the blood glucose will rise, and the pancreas begins to produce insulin. Insulin is responsible for controlling the sugar that enters your cells. Without it, it's as if the cell doors were locked, and sugar could not enter, staying trapped outside. And where is the outside? In your blood. Thus, your blood sugar will rise without insulin, or if your body is less sensitive to insulin. Therefore, if your body is sensitive to insulin, the amount of glucose in the bloodstream returns to normal quickly after you eat. On the other hand, if your body is resistant to insulin, it's like the key doesn't fit the lock. It's much harder for glucose to enter the cell. The key is faulty. Have you ever had a faulty key? Is it easy to open the door with it? That's why, when you have insulin resistance, your blood sugar takes longer to return to normal, or doesn't return to normal after you eat. Can you see how insulin resistance is closely related to prediabetes and diabetes? 70% of obese individuals have insulin resistance. Almost 50% of overweight people do. And even among lean people, 20% have some degree of insulin resistance. Oh, and see, if your body becomes resistant to insulin, your pancreas will need to produce more insulin to get rid of the blood sugar. The more insulin resistant you are, the more insulin you need to win the arm wrestling match. On one side, your cells no longer want more insulin, and on the other, the pancreas has to manufacture more insulin. Eventually, the pancreas won't be able to keep up. It will be working too hard. And what happens if it can't perform its function? You will become pre-diabetic and, subsequently, diabetic. These tips I'm going to give are for your body to become more sensitive to insulin, for the key to fit right on the first try. And it doesn't matter what type of diabetes you have, the more sensitive to insulin you are, the less insulin your body will need to keep your blood sugar at normal levels. What are the 9 tips to improve your body's insulin sensitivity and lower blood sugar faster than anything else? Tip number 9. Avoid alcohol consumption. Avoiding excessive alcohol consumption is important to keep blood sugar levels stable. Alcohol can cause unpredictable fluctuations in blood sugar, both raising it immediately after consumption and causing dangerous drops hours later, especially if consumed without food. For those with diabetes or glucose control issues, it is essential to moderate alcohol consumption and monitor blood sugar levels frequently after drinking. Tip number 8. You need to sleep better. See how important. When you sleep poorly, it increases your insulin resistance. The key won't fit. But do you need to sleep poorly all your life? No. One night of poor sleep increases insulin resistance. And the reverse is also true. If your sleep is poor and you start sleeping more, it improves your insulin sensitivity. When you sleep poorly, it inflames your body, raises C-reactive protein levels, messes up your entire metabolism, mainly because of cortisol, but also increases ghrelin, which is a hormone that makes you hungry, reduces leptin, which makes you feel full, so you won't want to stop eating, and reduces growth hormone, which in adults won't make you grow, but leaves you with more muscle and less fat. Sleeping poorly is a bomb for those who want to control their blood sugar. People who have a small baby, or who started working at night, or to take night shifts, or even if they move to a noisy or very bright place, your blood sugar goes up. The HbA1c, which is the average glucose over the last 10 weeks, goes up a few points. If you want to improve your glucose, have a routine for sleeping and waking up. Do not let light or noise interfere with your sleep. Install blackout curtains, or if not possible, an eye mask works, and earplugs. And of course, cut caffeine after 3 in the afternoon, even if you think you sleep well having coffee at dinner. It disrupts your sleep waves. You are not deepening your sleep. You are not sleeping the way you need to sleep. Tip number 7. You have to manage your stress. If you are diabetic, you may have noticed that if you are very stressed, nervous, your glucose shoots up like a rocket. Stress is like lack of sleep. You will produce stress hormones like cortisol, adrenaline, glucagon. Glucagon breaks down the glycogen in your liver into glucose to be used as a quick energy source. But I live stressed. Let me tell you a secret. This continuous stress is worse because it keeps the levels of these hormones always high. Your key never fits the lock. Stress will make you produce more insulin, and too much insulin makes you gain weight. Where will you gain weight? In the belly. Stressed people have belly fat, the visceral fat, which is the most dangerous. Have fat in the liver. So that's why I had a fatty liver on the ultrasound? One of the causes. And fat in the liver, fat in the belly leads to what? Insulin resistance. You are pouring gasoline on the fire, and you don't know why your glucose won't go down. How are you going to improve your stress? Sleeping better helps. Breathing techniques help. One that I remember is the 4-7-8. You inhale counting to 4, hold your breath counting to 7, and exhale counting to 8. It reduces tension. Another one mentioned in the book, The Art of Impossible, by Stephen Kotler, is to write down the things or people you were grateful for that day. Tip number 6. You have to exercise. And this is very, very important. Exercise helps you sleep better, makes you less stressed and happier, and also, when you exercise, your muscles use more glucose. You're going to walk, your legs will need glucose, your arms will need extra glucose. And what happens with your muscle cells? They pick up the glucose that's left over in your blood. More efficiently, you don't need as much insulin. You will improve your body's insulin sensitivity immediately. And this can last from 2 hours to 2 days, depending on the type of exercise. Even if you lift weights, you will have more muscles, and your muscles will burn the sugar in your blood. Not to mention that exercise regulates hormones if you're a man, increases your testosterone. To increase even more, do leg exercise, leg press. And exercise reduces belly fat, and this will make you less inflamed. This, yes, is the virtuous cycle, one thing improving another, which improves another. That's why I insist so much on physical exercise here on the channel. It's not for nothing. Can it be walking? It can be biking, it can be water aerobics, it can be swimming, it can be jumping jacks at your home. Can. Everything can. I want you to move. You have to take care of yourself. And a tip if you have little time. A 2022 study showed if you go for a walk for about 15 minutes after eating, it can improve your glucose a bit. Even if you walk just 2 minutes, it already has some impact. 2 minutes, 15 minutes. If you take just this from the video, walk for 15 minutes after your lunch, even with a full stomach. It was worth the video. How much exercise? At least 150 minutes of moderate physical activity per week. But look, if I had diabetes, I would exercise every day. Tip number 5. Increase fiber intake in your diet. If you think of a silver bullet for improving your blood sugar, it's this. Eat more fiber. You might find it strange, but there are solid and indisputable data that fibers are the best supplement of all. I think the soluble fibers, found in foods like oats, apples, legumes, and some types of beans, form a gel in the stomach and intestine. This gel helps slow down the absorption of sugars, which means you will have fewer glucose spikes after meals. But with fibers, this process is slowed down, and sugar absorption becomes more gradual, helping to stabilize blood sugar levels. In one study, patients who added 2 tablespoons of fiber before meals saw significant reductions in blood sugar levels, 13% at breakfast, an impressive 65% at lunch, and 41% at dinner. And the beauty is that fibers keep working, controlling blood sugar throughout the day. But do you need to buy fiber supplements at the pharmacy? No. fibers are present in all plant foods. We're talking about vegetables like spinach and broccoli, fruits. Opt for low glycemic index fruits like pears and apples, with the skin please, avocado and kiwi, and legumes like beans and lentils. But my favorite is chia, which has a lot of when you mix it with water, and can be easily added to various dishes. The idea is to increase fiber intake to more than 35 grams per day, which can be done through both foods and supplements. Tip number 4. Adequate hydration. Staying well hydrated is crucial for controlling blood sugar. Drinking enough water helps the kidneys flush out excess glucose through urine, contributing to the stabilization of blood sugar levels. Adults are recommended to drink at least 8 glasses of water a day, but needs can vary based on physical activity level and climate conditions. The amount of water recommended per day can vary significantly depending on factors such as body weight, age, climate, level of physical activity, and overall health. A common rule is to drink between 30 to 35 milliliters of water per kilogram of body weight per day. For example, a person weighing 70 kilograms should aim to drink between 2.1 to 2.45 liters of water daily. However, these are just general guidelines, and individual needs may vary. For people who are very physically active or live in hot climates, it may be necessary to increase this amount to compensate for fluid loss through sweat. Additionally, specific health conditions, such as kidney or heart issues, may require adjustments in water intake, which should be discussed with a doctor. Choosing water over sugary drinks is a healthy choice that can prevent spikes in blood sugar. Tip number 3. Cut sugar and try to reduce refined carbohydrates. Another important thing to do is to reduce the intake of refined carbohydrates, like rolls, pasta, instant noodles, crackers, is to cut the sugar. This will help your body become more sensitive to insulin. This happens because eating patterns high in carbohydrates tend to cause spikes in blood sugar. Eating smaller portions of carbohydrates regularly throughout the day, especially if they include fiber and protein, gives the body less sugar at each meal, making it easier for insulin to do its job and avoiding glucose spikes. Maintaining regular eating benefits insulin sensitivity, and choosing low glycemic index (GI) carbohydrates is even better. For example, chickpeas, beans, lentils, sweet potatoes. Sweet potatoes release sugar into the bloodstream more slowly than regular potatoes. I can't live without pasta or bread. Make whole wheat pasta, which has more fiber, or make your whole wheat bread at home. If you want a specific video about diabetic-friendly eating, write it down below. If many people are interested, I will make it. Besides, it's important to reduce the intake of sugars, mainly ultra-processed foods, which have a lot of high fructose corn syrup. Now, if you swap all that for unhealthy fats, I'm going to eat bacon, sausage, you might be shooting yourself in the foot. You might worsen your insulin resistance as well. The best strategy is to prepare more meals at home, using whole foods and staying away from fast foods and foods you know are harmful. Remember, smart food choices make all the difference. Tip number 2. Add spices and a few secrets to your diet. If you like me, alternative things, know that cinnamon, ginger, turmeric, fenugreek, and garlic can increase your insulin sensitivity. Rosemary, basil, oregano, all have bioactive compounds that can reduce inflammation and help your body better metabolize glucose. 2 beverages can also help. One, you may have guessed, is apple cider vinegar. Apple cider vinegar helps to increase insulin sensitivity, reducing your blood sugar, and it also seems to slow the stomach from releasing the food you've ingested to the intestines. The other beverage is green tea, which has epicatechin that help to increase insulin sensitivity. Tip number 1. The most important, lose weight. If you are above your ideal weight, or well above your ideal weight, make an effort to lose weight. Now, if you are already lean, this tip is not for you. Why losing weight is so important for improving your insulin sensitivity. I've said it before, but I'll repeat. If you lose belly fat, you will reduce inflammation because that belly fat inflames. That fat also makes you more resistant to insulin. Your key simply won't open. Obesity is the key factor for insulin resistance. Back in the day, when there weren't so many overweight people, look at your photos from the 1980s, 1990s. Everyone was slim, and there were far fewer diabetics than today. If you lose weight, you'll improve your sleep, you'll snore less, you'll feel more energetic, and you'll move more. And most importantly, you'll give your pancreas a break. You'll give it a rest. It deserves it. Think fondly of it. Did you know that if you're producing insulin in excess, you increase your risk of pancreatic cancer? And you know that is very, very serious. But not just that. Breast cancer, bowel cancer, kidney cancer, thyroid cancer, uterine, endometrial cancer. If you want to live well and healthy, you need to lose weight. Small changes in your diet and habits can have a big impact on controlling your glucose. I hope you incorporate many of these tips into your daily life, and that you manage to get rid of diabetes, or never enter into diabetes. Give it a try. I guarantee it will improve. Thank you for watching. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video.